All right. Do you guys see my slides? Okay, sounds good. Well, I'm Kathy Makowicz. I work with the Public Health Department in Washington County, and thanks for the opportunity to come and talk about the Minnesota Student Survey. I was around when the very first student survey came out in 1989. And I remember there used to be, it was a networking group of people who were working in prevention. Actually, a lot of us had like a treatment aftercare kind of background because prevention really wasn't a really strong thing back then. So I remember at this meeting, some of you may know Jay Jaffe. Jay said, hey, so I heard that like this survey just got released. Should we look at it? So we looked at it at a meeting and everybody was like, this is amazing. This is wonderful. Wow, what just a wealth of information. And so it has really helped with coalitions within our county and others. So I'm going to talk just a bit about my role in the whole process, or our county's role in the whole process. So, oops, my slide doesn't seem to want to. Okay, so just kind of within context, so I work for a public health department, and so our role in public health is to assure conditions in which people can be healthy. And we do that through, it's a three-pronged approach of prevent, promote, and protect. Prevent diseases and health promotion. I think through COVID, the work of public health has really risen up to like, oh, that's what public health does. Through contact tracing and vaccinations, through promotion, promoting wellness by encouraging healthy behaviors, and then finally protecting from the spread of infectious disease and environmental hazards. I think for that one, all the work in tobacco and addressing tobacco, clean indoor air is probably the best example in terms of protection. For how we actually do this is through, this is called the Public Health Wheel. It's assessment, policy development, and assurance. And assessment is where the Minnesota Student Survey comes in for us. So assessment is basically what's going on in the community. Policy development is like, so what can we do about it with policies and plans and programs? And then assurance is making sure that it actually gets done. And all of this is around with a focus of equity in the center of everything. So for the assessment piece, the student survey is just a really integral part of what we do within public health, at least for our department, and I know for other county departments, it's the same thing. So for Washington County, in 2019, the last survey, there was 30 years of local data, and we have 5 public school districts that are in the county. And we've had 100% participation since the third administration of the survey, since 1995. There was, in the 1992, one district decided that they were going to do their own survey, and it really kind of messed things up because it just really, well, it just messed things up. So then since then, all the districts have participated, which I can't say enough how grateful I am and how we're extremely indebted to everybody who was part of the survey, whether that's the students for sharing their life experiences, the districts for actually taking the time to administer the survey, and the statewide partners who take all that information and make sense of it, for developing presentations and identifying focus and trends. For us, it truly has helped guide our process so that we didn't have to recreate the wheel in all the different counties in the state. I should note that North St. Paul with Oakdale is in Washington County. There's a huge chunk that's in Washington County, but their service center is in Ramsey County. So they're included in Ramsey County data. So that's, if you're looking at county data, kind of make sure that you know like which districts are within that. You can see in 2019, we had over 9,500 students that participated. So our process in Washington County is that we write and get permission from each superintendent to get the data. We then work with, used to be Ann Kinney, but now is whoever that group is that her replacement is, gets us the data. We have a student survey work group, which we've identified key contacts in each of the districts, and I communicate with them about the survey, the process, the results, presentations from the state and also county. We then do presentations to key stakeholders, and then finally share the results on our website. So when I was thinking about so what is the student survey? What do we do? I talked to a lot of different people within my department, and I love this quote by one of our public health management analysts. We rely on the data so much. I was going to say, I can't tell you how much we rely on it, but then it's like, well, I am going to tell you how much we rely on it. So we rely on it for, in the top part of the image on the screen, to drive and inform planning, evaluate success, secure funding, increase collaboration. We have a new focus on ACEs and protective factors, and then identifying emerging needs and issue. And I just want to say that the student survey is the data set that we use for youth issues in the county. And it really forms the foundation for what's going on with youth. So again, I will probably say it 10 times, I'm eternally grateful to students and districts for taking the time to do it. So a couple things, we've been doing this for a long time, taking a look at the data. When I started in Washington County 23 years ago, there was many student surveys prior to that. So we have also always made a commitment to look at the data and what that means for us. You can see some of the things that we monitor that also then go into the report that I had talked about. If some of our data is too small, we use statewide data, so we don't identify a certain population or person in a district. This last time we used the state data in making presentations to talk about things like mental health and gender, mental health and sexual orientation, and mental health and race ethnicity. So again, many thanks to the Student Survey Interagency Group and others for your help in kind of looking at statewide, because we truly do model what we talk about based on what the state talks about. So we appreciate that. This is, I'm going to show this. This is like our favorite slide, and Melissa and Jacqueline Freund, where I did a presentation, and I looked at this and I went, yes, this is it. So we stole the idea, borrowed the idea, and did it for Washington County. So this is an example of something that is developed on a statewide level in statewide presentations that then we adopt with our local county data. So this is looking at 8th, 9th, and 11th grade, and then comparing 2016 to 2019. So it's going to be interesting in a lot of this to see what happens in the 2022 survey, especially with e-cigs. We're really looking forward to see what's happening with that. I should say, even though, so this is like our favorite slide, it's my director's favorite slide. In fact, he always says, I love that slide. Anyways, that if we take this slide and flip around the statistics, then it still looks like, or you can see that most kids are not drinking, most kids are not smoking, most kids are not using vaping or marijuana. So it's just kind of a comment on the whole thing, that it's just a different way of looking at it. A big piece of what the student survey does for us is drives and informs our planning and programs. Every 5 years, public health departments are required to do a community health assessment, and then based on that assessment, come up with a plan of what they're going to do to address the issues that were identified. At the same time, health systems do a community health needs assessment, or a CHINA, and then we also use the information from the student survey a lot in our accreditation process, and I'll talk about some of those. So our community health assessment, the last one we did was in 2016. You'll see the 3 topics on the right: mental health and well-being, nutrition and physical activity, and substance abuse. The student survey was the foundation for the data on youth issues and our community health assessment priorities. So we take a look at everything, and again, the student survey was the data that we looked at. For public health accreditation, Washington County was the 3rd health department in Minnesota to be awarded national accreditation status. And basically what that is it's a measurement of a health department's performance, again, a set of nationally recognized practice-focused and evidence-based standards. And currently there's 10 Minnesota counties and the Department of Health. Their first domain, and there's 12 domains, is how does your department use data to inform programs? Student survey, cited over and over and over again as the foundation for data on youth issues. Evaluating success is another one of those buckets in the little pie chart at the beginning. When I was talking to the management analyst, I was saying, so how else do others use the student survey? And she told me this example, and it was really interesting. So our United Way Washington County East, they have 4 areas of funding that they fund the communities within Washington County. And the funding can focus on basic needs, self-sufficiency, health, or youth. And what they did in 2017 was that they changed their entire requirement and reporting process to results-based accountability so that they can effectively measure the impact of their funding and then communicate that progress that funded agencies make of what's going on in the community. So when an agency is funded, they choose 3 to 5 indicators that they'll monitor to see the impact of their work. Basically, are they better off? And for the youth, the student survey is the basis of those indicators. So I thought this was a really fascinating way of how the student survey has been used by an agency and really forms the basis for kind of giving direction to funding focusing on youth. Secure funding is the next kind of bucket. We provide our county data back to districts, communities, and agencies, and I know that they have used that data to help obtain federal, state, and local grants. Our most recent example of that is the Prevention and Intervention grant that Forest Lake just received, and the student survey will be the basis of the Positive Community Norms grant, their evaluation piece. So it's a really practical piece of really giving kind of a sense of what's going on with kids. I also know that school-based mental health initiatives within our county public health departments, we have based funding and giving out funding based on what the high needs are in the student survey. Collaborations, coalitions and schools use the county results to inform programming, focus, and activities. Way back in the first 1989 Minnesota student survey, we took the information and presented it to a group of community members, formed a coalition based on that, and their whole programming has been year after year looking at the results of the student survey to determine, so what is it that we're going to focus on? What are the main issues? And so it really has helped a lot of the community coalitions within the county to look at what's actionable and where should we put our limited energy, time, and money. ACEs and protective factors. So what's unique about the student survey and what I appreciate about the leadership from the folks, the interagency team and Melissa and Jackie and others is the focus in the last student survey on ACEs and protective factors. So for Washington County in 2019, with the 2019 data, we wanted to do an analysis, and this is one of those projects that, yeah, we had great idea, but then COVID happened and the world turned and flipped on its side, and so this was a project that just never got done this time. But I think that we are wanting to focus on this for the 2022 data, taking a look at what protective factors are in kids' lives to help them build relationships and life skills, what are the frequency of those, and then what's most strongly associated with positive health outcomes, and what can we do so that we can address those. The other kind of piece of the puzzle is that identify and respond to emerging needs and trends. Youth issues have changed over time. I remember when self-harm was added into the survey, when vaping was added into the survey. Vaping wasn't even asked in the 2013 survey. And it's like, that's not that long ago. And it really shows how quickly things can change in our world and have changed in our world. Mental health and kind of the tweaking of those issues too has been really, really, really important. So after a presentation is made, and whether that's to a community coalition or to an agency, some of the discussion questions we ask after presentations are: what stood out for you? Were there themes that emerged? How can you use the data in your community or school? And then how can you get the data back to youth in your district or community is a really important question also. So again, kind of my little buckets of what we do. And again, how the student survey is the foundation for data on youth issues within our county. And again, I can't say how much we appreciate it. So what's next in 22 for Washington County? A deeper dive into the data, focusing on ACEs, protective factors. It's going to be real interesting to see what happens with COVID and the impact of those. So looking forward to any kind of input into that. COVID has really been a watershed moment for public health. I don't think our work will never be the same again. So I think the world has changed in a lot of different ways. So it's going to be interesting to see how that plays out in the student survey. And then based on results, how can we change our work to better address the needs of youth, and where do we need to pivot? So that is it. And again, one more time, thank you again to students and schools. We could not do it without you. So questions? Comments?
Kathy, we have a question in the chat. Lots coming out recently about the effects of social media like Facebook, Instagram, Twitter on negative mental health outcomes for youth. Are there any MSS probes asking about the influence of social media on youth? I guess that could be kind of a more general question for those who know the MSS.
Yeah, I'm going to turn that over to Melissa.
So we just got the 2022 questions yesterday afternoon, and I haven't been able to pour through them, but I will do that while Kim and Tanis are presenting, and so let you know in the chat, unless I know there's some members of the MSS team on the call, so if you beat me to it in the chat, please feel free.
One thing I forgot to say is I really appreciate that every time when the student survey is going to be administered, like the year before, kind of a notice is sent out. Hey, what's going on? What do we need to do? Any questions, anything happening with youth that we need to focus on? So I really appreciate the interagency team for asking those questions too. All right, thanks for your time, everyone.
Thanks, Kathy. And if other questions for Kathy come up, if we've got a little time at the end, we can circle back. But now I'd like to hand it over to Kim and Tanis.
All right. Thank you so much, Melissa. And Kathy, thanks for that great overview. I was like, oh gosh, we've used it there too. We've used it there too. I think I really have been involved in using this data since probably '89 as well. As you reminded me, that's when it first started. And I was on the opposite end in a probation world at that time, but really didn't start my focus on MSS, I think, until about 2011, when we made application as a small agency to partner with our Deer River School District for the Planning and Implementation Grant, which I now understand is renamed the Positive Community Norms Grant, which is great. So Tanis and I worked together in the Deer River School District at that time in two different roles, but did a lot of work applying for that grant. And for those of you on the webinar who have had experience with that grant, learning the Spirit Science Action Return Framework and how MSS data can really help tell the story for our communities I think that's what Tanis and I would like to focus on, and really give you some specific examples of how we have used the data to drive some programming and action in Itasca County.
I think about the, that first meeting we had just with our MSS data before we had done any of the PCN surveys or any of the student surveys, and like people were just like ready to commit to action. And so I think about how like it creates that urgency, the data that's there, that can really leverage community initiatives and also like community like pride, right? Like, no, not in our community. We're not going to let this happen. We're going to, engage in some sort of action. And so I think that's really another part of the story that we're going to talk about today.
And I think like even from the beginning, as we worked our way through those first 5 years of that grant and then applied for a neighboring district, Grand Rapids, which just finished their grant here in June. As Tana said, we really were like that data is, it's data, it's a number. And we really took the approach that doesn't tell the whole story. But knowing that it's so important to have data to drive our action and programming, how do we turn those numbers into a story? And that's where, people like Melissa and the team helped introduce to us how to utilize protective factors, really understanding what that data meant and being able to utilize it to say, this may be our concern, but we have hope. And using those protective factors to whatever the concern was really allowed us to start bringing more people into, I would say, our cause, from different disciplines, because we could all relate to a number, to data, but then take it and tell it in different avenues and venues of how that was creating our community story. From the family services collaborative perspective, Tanis has been involved with this as well, but we became involved in the ACE project with DHS initially in the rollout, I believe 2017-18. And again, the MSS has been just instrumental in our ACE cohort to, as Kathy mentioned, talk about protective factors. How many of us have gone to some of the ACE presentations or things and we're like, now what? It's not always a very positive kind of look at what's happening. But when we're able to really, again, kind of frame it with a message of hope, and for those of you who have followed Dr. Linkenbach's work, even hope meaning healthy outcomes of positive experiences, we've really been able to, again, balance concern and hope with our ACE project here in Itasca County. And that's been really, to me, beautifully woven into our P&I grants. And again, MSS data is at the heart of teaching community how to read some of those numbers. And again, then telling a positive story.
Well, I think we really, when we were thinking about how we would use the data, it's about creating that community readiness for change and realizing that like, it's not a scapegoat to say like, not in my backyard, right? Like it's easy when you hear some of the big numbers or the statewide data to say, that's great, but not here. Here we're different, right? I mean, I think that's kind of our natural tendency as humans. And so, utilizing the MSS data really said like, hey, guess what? No, it is here. So we have done kind of two bigger things with the ACEs project in relation to the data. And so one of the things we did is here in District 318 in Grand Rapids, this summer, at the end of the summer, or the start of the school year, we had a presentation about, adverse childhood experiences and how to prevent ACEs, and I mean, all sorts of things, and really focusing in on creating a trauma sensitive classrooms. And so we were able to use the data to really show, hey, no, this is happening here. And India, I don't know if you can click on the ACEs project. We have some links in here just to show some examples of how we've actually like given the data out.
Can you see that?
Yep.
Okay, cool.
Yeah, so you can see that, like, just trying to build that community buy-in, showing the prevalence, showing the experiences by students, just like from a county level, but we've also drilled down into that school level because, I think we have a very large county here. And even here, it's easy to say, oh, that's nice. That's everyone in the county. That might be more rural areas. That might not be here. And so we were able to really show, no, this is a concern here. And this is our responsibility. And so as a district, we've made a commitment that twice a month, we are using this guide. If you've ever seen it, it's called Creating a Trauma-Sensitive Classroom. And we're going through different strategies and discussion points with staff about how are we going to change the narrative that our data is showing us related to adverse childhood experiences, and making sure that we're layering in protective factors for our students and the things that we can control from the school system. So this is a lot of stuff. We can go back to the other slide, but I just wanted to show some examples like throughout of like how we've actually like handed out the data so that you can see that too.
And I think what, when Tanis talks about us being able to really drill down by not just county, but by specific district, we have 4 school districts in Itasca County, but to then really, talk to an audience of teachers that say, no, this is right here in your high school. These are your high school numbers. That just really, I think, gives some energy to what our ACE cohort has been trying to do. I so appreciate Tanis being our champion in the schools, and she's worked in 2 of our 4 districts here. But there's, to me, that presentation, one of the things that I think we heard from both teachers and community members outside that helped in that presentation, including, public health, U of M Extension, and one of our private or nonprofit agencies that runs youth and family servicing programming. We're all here to support teachers and our schools because they have our kids for the majority of that time. And it's just so important for them to feel supported in the good work they do during the school day, and trying to get us all to share this language about protective factors based on data is a pretty powerful thing to watch happen in a community. I think that's been a really great learning for us with this. Moving on to the truancy prevention program. Gosh, we pulled a similar, Melissa has been great with this, and I think there's a link on there, but we pulled and presented at a program sharing conference back in 2017 with a very similar document. How are we looking at school absenteeism, which is kind of in my backyard as the director of the truancy program in our county. How are we using MSS data to not just look at our numbers, but what do we know are outcomes of kids missing school? And we all know that, missing school just tends to be the tip of the iceberg in many of our students' lives. And so there again, we were able to use some MSS data to kind of put stories around some of those numbers when we talk about high chronic absenteeism numbers. And that's been a great narrative for our program that we go back to every year when we're reporting out to our stakeholders, which are our, Family Services Collaborative Board. And that's made up of, our superintendents as well as our county department heads. And it's just allowed another opportunity to use this data and be able to understand it and then get it out to the public as to how important school attendance is for other, preventing other risk factors that can show up. We definitely know that we can't have a direct causal, one factor can't cause another factor, but showing the association is very powerful, I think, for a community and for a school district. And again, that has then launched our kind of public media campaign about how important daily consistent school attendance is for students to not fall into all these other at-risk behaviors. And so again, the MSS has been just kind of the center point for us in that realm.
So being a school counselor, I don't know what you guys know about school counseling. It's not the old guidance counselor that maybe many of you had. We are, data-driven master's levels professionals now working on academic, personal, social, and career and college readiness. And so part of that is really like, how do we use data? How do we collect data? And MSS is one piece of data that I, circle back on frequently. I'm always like waiting for it to be released, asking when I can get the next data, making sure that I can get those pieces, because it really just does, even though it's that snapshot, it's one of our success indicators when we look at the broad variety of indicators that we have in a school system, the MCA data, the STAR data, grades, graduation rates, all of that. MSS is one of those same indicators, right? And so I just put one example. At the last district that I worked in, we did a presentation on being an LGBTQ plus inclusive educator. And a lot of times I think in rural towns, it's easy. There's still a lot of bias and that exists and in smaller towns, right? I mean, we know that. And so this was a way for us to be able to say, okay, yep, we're hearing more about GLBTQ plus students, and guess what? They're here. And let's take the MSS data and learn about what some terms mean, how prevalent it is in our school. And then, it took us into an activity about, how to help more students, making sure that we're creating safe spaces for all of our students and relevant spaces. And so that's just one example of how, as a school counselor, I have used the MSS data, but there's countless other ones. I'm really excited about the 2022 survey data, because that's going to actually give us a better snapshot, I think, of like what the pandemic has done with students and mental health. I mean, we hear the headlines all the time. Student mental health is worse. There's all these things happening, kind of the news crisis. And this is going to actually give us some indicators and some actual data points that we can look at and say like, okay, here's an area that we really need to focus on building skills for our students at these certain grade levels, right? Or here's a gap that we're seeing. And so really helps drive our data-driven school counseling program. So I'm excited for the 2022. We also did, so we use the data from the MSS to help apply for a grant with the SPIF-RX to get curriculum to train counselors in mindful schools programming. And so we got, because of the data and showing students concerns related to self-regulation and some other attention things, like if they can pay attention in school and some of those indicators, we were able to track and get secure funding for that curriculum to be purchased for our school. And really just focusing on like our dials of control. I think that last bullet is really about like, we can't always control the risks, right? I mean, we can do our best, but we can control our protective factors. And like as school systems, and I think as like these larger community systems that many of you represent, we're kind of all folded together. And if we can really hone in on some of those protective factors and see which things are working and which things, we can influence, that's really how we're going to get the best outcomes for our students. And that's what this is about, right? Like our future, our kids, and where we're headed. Kim, anything else?
Well, I just think just some closing thoughts. I think like building our network, when I think about this from 2011, we're at 10 years of kind of this integrated work in all of this. And I think just Tanis mentioning the mindful schools, there was a curriculum update to that. And it's not in the district budget to, pay for that update, but they've trained some teachers now and counselors in this curriculum. So she came to the collaborative because part of our ACE project is continuing this work. And of course, we're going to fund that update for our teachers, because we all are sharing, I think this work in one way or another. And so I really feel like the net has been cast, and we're trying to, bring other people into kind of this shared language. And it's been great to see. There's a lot of work to be done. I'm super anxious as well for the 2022 data. Running a truancy program over the last 2 years has not been the greatest joy. But gosh, I'm hopeful for kids that they are making connections with caring and competent adults as we're back and having kids in school. And I think we all know how important that is for them to have that face-to-face contact with those adults. So hopeful, always working with hope and concern side by side. So yeah, I think we're ready for questions.
Yeah, thank you.
We have a couple questions in the chat. Someone was asking about how you got that report on the absenteeism. And Melissa said you guys worked with the Jackie from SUMN, correct, to get that data?
It was both Jackie and I back when I was in the role that she's solely playing now.
Yeah, so we can put a link to SUMN in the chat, and I believe you can find Jackie's contact info from there, and she can help with reports like this from the MSS. Someone asked, do we have any idea what was some of the reasons for so many students being absent?
From, I don't know.
The absenteeism report.
Oh, from the report? Oh, goodness. Well, there's lots of reasons why kids are absent. But I think that that's, part of our goal with our program is to show that school absenteeism isn't usually about kids wanting to miss school, and that's why we have found relating absenteeism to other social emotional issues that kids and families are facing has really completely transformed our program from a punitive program, I think back when I was first here, to really a prevention-based program that deals with a lot of partners, I would say, in our county. Yeah, anything that you think from a school counselor's perspective on that?
I think, anytime we're talking about like chronic absence, and the great thing about the MSS data is that like you can kind of like drill into this a little bit more, right? But I think it's always a long pattern of disengagement for students who are chronically absent, and so it takes a long time to get them back in school, and so it's a long process.
Any other questions for them? Okay, cool. Well, if there are any others, feel free to put them in the chat and we can address them later. I'm going to move on to the next. Whoops.
All right, thanks. Take it away, Jill.
Hi, everyone. My name is Jill Ambule, and I am a certified prevention professional in Hawley, Minnesota. I'm pretty sure if you ask Melissa Adolphson or any of the RPCs on here if I liked data 5 years ago, they would be like, no, Jill ran from the room screaming. She didn't want anything to do with it. But also because of those same people, I now have a love for data and a need to always want to know more. Why is the data the way that it is? So I kind of took this assignment as, what are the things you love about the Minnesota Student Survey? So we'll just kind of go through some of these things here. And if you want to switch to the next slide. So the quote, without data, you're just another person with an opinion. The first time I heard this quote, I thought, wow, that is rude. Way to unvalidate everybody's feelings and the way that they look at data. But the more I thought about it, I was like, wow, that is completely true. And that we live in a small community, which I heard others say. In 2015, 2016, our students suffered some trauma. I apologize for the school bell. It's the longest school bell ever, thank you. And because of that trauma, we really saw some kids hurting in school. Of course, as adults, we like to think that we know what is going on in our community and what those solutions are. But a lot of our past efforts in Hawley had just been talking. We're a very responsive community. We respond to tragedy very quickly and very strongly. But through this data, we were actually able to find some really concerning numbers about youth substance use in our community. So the MSS data helped us apply for a planning and implementation grant, which Kim nodded to earlier in their presentation. And over the past 5 years, we've worked to build a program that supports youth and highlights the positive things that are happening in our community. So as they mentioned, PCN is the new P&I, but we just ended our cohort a few months ago. So when that cohort ended, we were actually able to use data from MSS and PCN to validate the need for a permanent prevention program in Holly, whether it was grant funded or not. So through that data, I know a lot of people that look at the data often find themselves asking why, wanting to know more. PCN surveys really allowed us to not only dig deeper, but to validate some of that data that was coming out of the MSS. I don't know about you guys, but in our small community, you could present a piece of data to somebody and they would just say, kids lie. That survey is not accurate. That's what everybody says. They're just saying what they want you to think. But when we integrated PCN and results were coming out very similar to each other, we were able to explain that unless these children lied in a specific manner on this survey, remembered those lies and lied on the PCN survey in the same matter, we really have to readjust how we feel about the data and trust that our kids are being honest most of the time. And I don't know about you guys, but our school is small, and until we started this PCN data or this PCN grant, MSS data was not largely shared within our school buildings. I think a few reasons for this are, number one, we get really afraid of things that reflect poorly on our school and our district. We get afraid to bring up things that that there's room for improvement, but we have no problem celebrating the things that we're doing really well. So one thing that this did give us was both the hope and the concern. Yes, it's great that we have kids that are doing so well, but maybe it's not so great that our kids are expressing that they have low coping skills. They don't have support at home. They don't feel the support of their community. So it really has allowed us to detect patterns and measure impacts of significant events. Within our P&I grant, we had a loss of a recent graduate to suicide. And I mean, just the way it rocked our school was we just didn't even know how to gauge the impact of that or what we should be doing as a district to support these kids who are hurting. When the loss has been the softball coach for the last 4 years, when these girls and these kids are tied to that person. So we did have a Minnesota student survey after that, and we were able to see that particularly kids in those grades that she was a coach for and kids that were close to her were dealing with some self-esteem issues and some suicide ideation. And can we say that that's the whole thing? No, but we can say that we're tracking it and we're looking for patterns and we're trying to help these kids be as successful as they can. And then, as I mentioned, with not freely sharing the MSS data, it took me many letters and emails to get somebody to sign off for me to have the MSS data when I started. But really, it's guided actions within our school about culture. The first presentation I gave that told our teachers that 35% of our kids did not feel that their teachers or adults at school cared about them was huge. There were people in the room with their mouths open, people that came up to me afterwards and said, that can't be right. We love our kids. We show them all the time. So that really inspired some action of, if our adults feel they are being supportive, but our kids feel that they are not being supported, where are we missing that translation? How are we showing our support? How are kids recognizing support? So with that, with our most recent surveys, we're seeing that go up. For Melissa Adolphson is working on the suicide prevention pilot project here in Clay County, and we can see through some of that data that our numbers are increasing of kids who feel adults at school care, feeling safe at school, feeling good about their future. We can start to see some of the fluctuation in that. And then, as I mentioned, without data, you're just another person with an opinion. It comes down to actual versus perceived needs. A lot of times as adult, we talk about if our kids just had this, everything would be fine. If our kids knew this, this issue would go away. And sometimes our perceptions are really off. Sometimes we just need to get some data behind that. So again, that has just been a huge part for us. We're no longer shooting blindly into the dark, hoping that something sticks. We're using data to drive everything. I even see our data and messaging carrying over into the school. For instance, we have a new athletic director. She's creating signs that say this percentage of kids participate in at least one extracurricular, whether that's fine arts, drama.
We seem to have, she seems to have frozen.
Maybe we could have Jason take over for Clay County.
Yeah, and we can go back to her if she gets
Unfrozen. Yeah.
Oh, that's a great picture of Clay County. Thank you. So everyone that's got said amazing and beautiful things, and I hope that you guys have listened. I don't have a lot to add. I am just brand new coming into the PCN framework. So for the last 7 years, I've been a tobacco prevention coordinator for 4 counties, Clay, Wilkin, Ottertail, and Becker counties. And so my perspective on MSS is twofold. One, you don't pass policies without data. You have to have stories. There's a whole lot of interesting things that go into it. But if you can't have the data that shows a need, you can't go to a city council person or a county commissioner and say, we need you to pass an updated tobacco ordinance, or we need more alcohol compliance checks, or things like that. It's just not going to happen if you can't show a need. And so it's so important to have this data. You need to have it behind you, and you need to understand it whenever you go, because unlike us, our city council members aren't sitting at home thinking, oh, geez, if I just had the MSS data and a cup of coffee, I could just kick back and read this. They need us to bring it to them and give them the information. And so it's very important. And then part 2, guys, I'm going to be, if you know me, I'm going to be super short for you. And part 2 is data equals funding. In my 4 counties, there is school systems that have applied for grants, national grants, state grants, and have not gotten them because they did not do fidelity to the MSS. Either they didn't do the MSS at all, they opted out, or they did it very poorly and they did not make sure that all of the kids had an option and an availability, that's the important part, to be able to take the MSS. And so they end up with numbers that look like they're a mecca for health. And then their counselors and their principals are like, wait a minute, that isn't what we're seeing. And so that's important to get that that data through. So if you are with a school, if you're a school administrator, or if you're talking to them, that's a definite point to bring to them. They might be thinking dollars and cents, or they might just be thinking, that's a whole day's worth of classes that we're going to miss out. How do we make up for that? Well, if they need help, and let's just be frank, we all could use some, right? Then it's in their best interest, in their youth best interest, to do a great job and make sure that they bring the MSS data home. So I'm gonna mic drop right there and say thank you, and let's take questions.
Feel free to type any questions in the chat or unmute yourself.
Hey, everybody, can you hear me? Okay, cool. Hi, I'm Sarah Mangan, PCN coordinator in Cloquet and Carlton. So thank you all so much for your time and your energy. I love how you energize the data. So as a person who's just starting in my role, I would like to start with some data. Like, so how do I get, where do I get in? How do I get into it? When is the last MSS survey that we can access? Is this a question to ask here? I'll stop talking. Okay.
Yeah, that's a
all my
great question.
Okay.
So the most recent data you'll be able to access for the Minnesota Student Survey is 2019. The 2020 survey is going to be launching January 18th of 2022. There are a couple of like initial recommendations I would make for go-to on the data. One is to go to the Minnesota Department of Education Data Center, and you can scroll and find the link for the Minnesota Student Survey data. And using that, you can search data for 2013 through 2019, all the way down to the district level. Another place to go to would be a site called Substance Use in Minnesota, which is SUMN.org. That drills down to the county, not the district level, but you can search for data on substance use, some mental health items, and a number of risk and protective factors. And that site kind of allows you to compare and contrast your data to other counties, to the region, to the state. But then also connect with your regional prevention coordinator, Laura Bennett, and she can help you out.
Sarah, this is Kim over in Itasca County. Congrats on the grant. I'm glad, Melissa. Yes, Laura is an amazing wealth of knowledge. I would also encourage you to talk with Donna Leekander if you have not met Donna yet. She's the family services coordinator over there. I know that one of the things when we started back with this grant is I really sought out who in the school district was sort of in charge of trying to organize the MSS data and the date the school was going to do it, just to help with promotion of that. And it's just really important to kind of everybody be on that same page. So like, you know, as we talked, we want as many students there who have opted in to take the survey, but just to make it be a really accessible survey for the student body and to be part of that, especially in your new role there.
Thank you.
Thanks, Megan Lowe put links in the chat to both the MDE portal and the SUMN website.
Any last questions for our panel? Okay, I'm gonna make a quick plug for MPRC. We're gonna have the recording for this presentation, so up on our resources page shortly. I'll try to get it up by the end of the day. And if you know anyone else who could benefit from this information, definitely feel free to pass it on. And Melissa, do you want to close us out?
Yeah, just a big thank you to everyone who joined us for the webinar today. A huge shout out to the presenters. Thank you for sharing your stories of success with the Minnesota Student Survey data. I think it's so great to just have those concrete ideas of what it looks like for a county or a school district to really dig in and use your data. And then I just want to shout out a thank you to, as we've heard from the presenters, to any school folks who are on here, any students who might be on here. Thank you for administering the survey. Thank you for taking the survey. By doing so, you really allow all of us on this call to do the work that we do.
Thanks, everyone. Have a good rest of your day.